The clinical advisors at Alosa Health are also practicing physicians. So that's one of the pieces that a lot of people don't realize. Not only are they researchers, but they are actually engaged with patient care on a daily basis. So they give a full balance. When they write modules, when they develop content, they not only consider the research portion of it, but they also fully understand the practical implications of trying to layer that research into action. And that's one of the greatest parts about being here, is they look at it from both sides of the coin. It is a tremendous team of people, and that's one of the highlights of being able to be part of this organization. You get to work with the brightest people really in the world to address some of the issues that practitioners are challenged with every day. And that's the highlight of being here. And that's one of the reasons I like to be associated with the group. I get a chance to work on some of the most challenging issues that practitioners are faced with daily, try to bring them a solution to some of their problems that they are faced with, and do it in a manner that actually improves patient care. And there's really nothing better than that.